Yeah, so my name is Adam Anderson, and I am the Health Data and GIS Supervisor at Tri-County Health Department in Colorado. And we had um, put together, using our GIS environment, um, basically an entire solution for doing case investigation and contact tracing. And so just a quick overview, Tri-County Health Department covers 3 of the 7 metro area counties in the Denver metro area. So we're Adams, Arapahoe, and Douglas County. We are about a third of the state state population and about half of the Denver metro area population. We have roughly 425 employees. We have 3 analysts that were really involved with creating this whole case investigation and contact tracing solution. And we, so we have 27 municipalities and 3 counties that we're responsible for reporting to. So the workflow that we had prior to COVID for disease investigation occurred primarily in a spreadsheet in terms of tracking our reportable diseases and doing case investigation and contact tracing around those reportable diseases. However, I think the situation with COVID, with basically every county in the country, or I guess every jurisdiction in the world for that matter, had just a lot more to deal with. We're not talking about 1 or 2 measles cases here anymore. We're talking about hundreds, if not thousands, of COVID cases. And so we were working out of a spreadsheet that was used by around 50 to 80 people, depending on the time period. And we were approaching close to 10,000 records within that spreadsheet. And so obviously everybody knows the kind of the pain points of using a spreadsheet with that many people, with that many records, and in this case, hundreds of fields. And so the workflow was becoming unmanageable, and we were looking for a solution that would help to streamline that data collection and also facilitate a better workflow. Because with that many people and that many people overseeing the work, there just needed to be a more streamlined way to approach this. And so the first slide you're looking at right now, we're just basically looking at the entire infrastructure that we have currently set up. And sorry, it's a little bit zoomed out, but we are happy to share this slide. But you can see the green are basically the different databases, and you can see the smallest green box over here on the left-hand side, and that's where data is coming in from our state health department. So they're reporting diseases to us or in this case, they're reporting COVID-19 positive tests to us that we're bringing into our system for case investigation. And the green or the blue boxes are basically websites that we've created. And so they are basically dashboards that are facilitating the workflow of moving cases between managers and case investigators and contact tracers that has been set up within our GIS environment. The red boxes within within the blue boxes or those websites are essentially data collection forms that we've embedded within those websites and dashboards to collect the data around those investigations. And then you can see how data feeds into those. If you look at the bigger green boxes, those are our internal case investigation and contact tracing databases that those websites, dashboards, and data collection tools feed into. And then from there, directly out of those databases, we're then able to populate real-time dashboards and real-time data feeds to our, not to just our public, but to our 27 municipalities and our 3 counties that we provide data to. So to really quickly dig into this, this is our kind of main dashboard that all of our folks can go to that we've created within our GIS environment. And essentially, if you can see all of these little blue boxes, all of those little blue boxes essentially correspond to one of these boxes that's on the dashboard in terms of where a coordinator would go, where a team lead, or essentially the manager of those cases would go, or where our case investigators would go. And then there's some statistics on our main dashboard that we have regarding the number of cases that we have in our system, how many have been investigated. And this has changed a little bit because we've incorporated our contact tracing into here too for these total numbers. And just a heads up in terms of what we've processed through our system right now is roughly around, I believe, about at this point, 7,000 to 8,000 cases have been processed through our system that we've built out, and then around 13,000 contacts. So this is the main site that they would go to, and for any of those positions, they can just click on their own box to go to their dashboard. And the main coordinator, so what happens with our workflow is that the cases come in from the state health department and they get distributed by our coordinator to team leads, and those team leads then distribute them to case investigators. So our our coordinators can see the incoming cases, click on those cases, and all of this information has been stripped of any personal identifiable information. So if you see anything, it's made up. But those coordinators can then click on the case, see the details about the test, assign it to a team lead, and then a team lead can then find that case in their dashboard, they go through some deduplication process to see is it at a nursing home, is it at some sort of institutional living facility, and see the details about that case before they then assign it out to a case investigator who can then follow up with all of the questions. So these tabs down here, you could see all of the different categories of questions that happen during the interview process, and then they can go through all of their cases that have been assigned to them and collect that information. And then our contact tracers do roughly the same process in terms of once the case investigator has enumerated those contacts, they can then, they come into the contact tracer coordinator's dashboard as newly reported contacts, and then the same process happens where they assign those out, and then they can do the contact tracing. And so the dashboards look very similar. And then we also have built out within our this GIS environment a lot of data search tools, so that way it helps to facilitate deduplication against cases coming in that are potentially contacts, or contacts coming in that are potentially existing cases. One of the big benefits to all of this is that within this environment where we have all of the cases and contacts stored, we can then provide live streams of data into our dashboards, so that way we're not having to update dashboards constantly, and the public has access to real-time data. And then also we're able to share the back-end data of what's populating this dashboard that you're seeing right now. We're able to provide that back-end data in a live tabular format, or also a geographic format, to our municipalities and our counties, who then we no longer have to provide many of the analytics that we were having to do on a daily basis, but provide it directly to them and help in terms of setting up their dashboards to look at infectious periods or testing data, and then they're able to do their own daily updates to their own staff and councils and boards of county commissioners.